Good afternoon, ladies and gentlemen. It's a pleasure to be here this afternoon. My name's Paul Bates. I'm the Medical Director for Australia and New Zealand. I've been with Bupa about 5 years now. Prior to joining Bupa, I worked in the States and worked for a company called United Healthcare, which is one of America's largest healthcare companies. As you can tell from my accent, I'm Australian, and that's where I studied medicine and also worked as a general practitioner and occupational physician. Today I'd like to talk to you about the future of diagnosis and diagnostics. Diagnostics really refers to the act of taking blood, taking samples of body tissues, doing scans, measuring the electrical impulse from the body to gain insights about healthcare. And it's a very important part of medicine. It's estimated that around about 70% of medical decisions are somehow supported or assisted by a diagnostic intervention. It's also heavily influenced by technology, but there is an important caveat, and that is that we shouldn't become bedazzled by technology and shouldn't forget the basics of good medicine. When I was a young doctor, I was taught that to make an accurate diagnosis, a thorough history and a thorough medical examination would give you a correct diagnosis in 90% of cases, and I still believe that to be true today. I was also taught that we treat patients, not test results. If I was to do a back scan of 100 healthy adults without any symptoms of pain, I would find abnormalities in their spine in roughly 6 people in 10. So I was just to treat those people on the basis of test results alone, I'd be giving people unnecessary treatment. I only say this because we all love technology, and me especially, and it's important to balance our love of technology with a good serving of common sense. The pace of innovation in diagnostics is dramatically increasing. More than 2,000 years ago, the ancient Greeks recognised that to make an accurate diagnosis, you needed to have a diagnostic protocol. And Hippocrates, the father of medicine, described tasting a patient's urine, listening to their chest, and looking at their skin colour, all as a part of his basic workup. Today, especially in the last 30 years, the possibilities have raised a lot. We have MRIs, CT, fibre optic endoscopy, and of course in 1997, the start of the genetic revolution heralded by Dolly the sheep. Dolly was the world's first cloned mammal. I'd like to talk about some trends that are occurring in the world of diagnosis. And the first trend is that diagnostics are becoming more targeted and less invasive. Here you see a picture of a person undergoing a biopsy for lung cancer, but I can show you a similar picture for someone having a diagnosis or biopsy for bowel cancer, prostate cancer or breast cancer. The common features are that it's invasive, it's painful, and it brings with it a risk of complications. But new technology can change this. Researchers realised that cancer and tumour cells gave off tiny fragments of DNA, tiny fragments of genetic material, which could be detected by new powerful machines. And these machines and these tests have the capability to eliminate the need for biopsies and for X-ray to do screening tests in relation to cancer. They call this technology a liquid cell biopsy. And the reason they call it that is because it really is a biopsy because it's coming from the cells, and it's liquid because it's coming from the blood. But potentially it can reduce the need for scanning and for invasive procedures to do cancer screening. There are also other interesting minimally invasive technologies in place. Researchers can today place sensors into joints, into catheters, and even inside wounds as a means to detect infection earlier. All these have the potential to be less invasive and to make treatment happen earlier and faster. The second theme is that diagnostics are becoming more real-time and also becoming more continuous, as you'll see in the next theme. Here you see a picture of a patient who has a heart problem, and these days it's possible to put tiny devices into the heart to help the heart work more effectively as a pump. This isn't new technology, but it still is relatively clunky. Today, these tiny devices need wires that go inside the heart, and patients have to come into a clinic every 6 months or so to make sure that the pump is working properly. But in the world of the future, wireless cardiac support devices will be possible, talking within the heart wirelessly and communicating to smartphones or smart devices all wirelessly, with the ability to change the way these technology works remotely. Even in the Cleveland Clinic today, patients can be monitored and have their information sent to a central monitoring unit consisting really of computer screens, beeping sounds, and staffed by doctors and nurses and lab technicians. They call this unit the bunker, And the reason they call it that is it resembles the off-field football referees you see in the NFL. And in a way, it provides support to the on-field referee who's the clinician at the bedside. Here you see a theme of more continuous. When I was a young doctor, for insulin-dependent diabetics, they needed to prick their fingers with a needle 4 times or more a day and then figure out how much insulin they needed. But the world is changing. This person has a device inserted inside her skin which can read the level of blood glucose, and it talks wirelessly to a smart computer outside that is connected to a pump which pumps insulin inside the skin. It's still relatively clunky. The details make it clear that it's not a perfect solution, but you can see we're moving into a world which is more continuous, more real-time, more virtual and more feedback, almost resembling an artificial pancreas. The next theme is that diagnostics are becoming more wearable. I'm a technology geek. I love technology. I also like data a lot. And so I bought an Apple Watch, which I have here. And I like it because, first of all, I like the technology, but also I'm very vain. And I like how the watch tells me how great I am each day and how much work I did and how much I accomplished. Today, the watch measures my heart rate, it measures how much I sit and how much I stand, how many steps I climbed and how far I've moved. And that's interesting. Other devices even claim to measure sleep, although the accuracy is not so clear, or blood pressure. The Bupa Health Foundation in Australia is funding research using a smartwatch and a smartphone to diagnose anxiety and depression. People who have anxiety and depression have small but measurable changes in the heart rate rhythm measured over a prolonged period of time. And it's shown that these devices can measure that and make diagnoses about anxiety and depression with the same accuracy as an expert psychiatrist. You can see how useful this is. Of course, individuals can actually get a real-time monitoring of their mental state, but also judge the effectiveness of treatment towards it, whether exercise therapy or medication therapy is helping them. It's also easy to see a future in which these wearable devices will measure heart rate, skin colour, oxygen saturation, sweat volume, sweat constitution, to give very interesting insights about a person's health. They may diagnose heart attacks, mental health, addiction problems. The possibilities are very interesting when you think about it. The next theme is that diagnostics will become more automated and with a greater use of augmented intelligence. Here you see a picture of a mammogram, which is currently standard of care to diagnose or to create screening tests for breast cancer. And as good as this is, even in the best of hands, the accuracy rate is still only about 85%. But it's possible to put this into smart machines and compare the results and the patterns seen on mammograms to what's known to be the pathologist in its surgery and get ever-increasing accuracy. And researchers are getting smart machines with close to 100% accuracy for this kind of diagnostic. In London, at the University College of London, researchers have developed a machine called Deep Medic. And this actually analyses scans from people with head trauma with a greater degree of accuracy and faster than a conventional radiology process. The final theme is that diagnostics will become more predictive and more personal. And of course, I'm really talking here about the genetic revolution and ushering in personal medicine. Today, it's possible to have genetic tests done faster and cheaper and more available than ever before. It's commonly best known for its ability to detect certain kinds of cancer. And indeed, Angelina Jolie, who's a famous Hollywood actress, tested herself and found out that she had a gene which made her at greater risk for breast cancer or ovarian cancer. That creates interesting personalised healthcare possibilities. She could have chosen to have more intensive screening. She could have chosen to have medication or preventive surgery. But either way, it's interesting that there's a genetic possibility creating personalised choices for an individual. But it will go well beyond cancer. Let's just say, for example, that I am a severe asthmatic and I'm worried that my child may have asthma. My child can have a simple genetic screening test, which literally is just a scraping of some cells from inside the mouth, and be sent to a lab. Let's say that diagnosis confirms that my child has the same genetic tendency as I do for severe asthma. The lab test can also determine which medications are more likely to be most effective and have the lowest chance of side effects. And a sensor placed on my child may detect early signs of asthma before there are even symptoms. As a result, you can see it's possible to use genetics wisely in this example to actually create an early diagnosis and an early intervention. So in conclusion, the future has very exciting possibilities, but some important caveats too. It's important to remember that all that glitters is not gold.